back to Body Beautiful. With us today, we have plastic surgeon Dr. Joseph Mele, and we're talking about cosmetic breast enhancements. Later, we'll be taking your calls, answering any questions you might have for the doctor. The phone number is 800-440-4884. We'll also be posting the phone number to the doctor's office, so be ready to jot that down. And any advice we give you today, you'll always want a second opinion. Okay, doctor, you brought some pictures. Let's go ahead and roll those and take a look. All right, there we go. Here's our first example.
So this is a breast augmentation. So what she's had done is placed implants in behind the muscle to help smooth out that upper pole and overall enhance the size of her breast.
So she went from maybe a size A to, looks like a C?
A to a C.
And how many cc's is that? Because you get that question,
patient, it's probably about 360 to 390, somewhere in that range.
Okay, and that's a fairly common approach that you take there.
Pretty common, fairly average implant size.
All right, you have another picture?
This is the opposite operation. This is where I'm reducing. So this is someone who typically would be complaining of back pain in the upper back and neck pain. She had pretty severe shoulder rutting where the bra dug into her shoulders. So we've done a reduction, and again, that C cup range is a good range. So for her, it's kind of a smaller side of the C, but certainly more manageable, easier for her to find clothing and be more comfortable with.
Okay, now what's involved in that? It's a little more extensive.
Certainly. Than
or a lot more extensive, because you're moving tissue, you're...
Right, for reductions, not only do we want to reduce, but we want to lift. So a breast reduction is similar to a breast lift with removal of breast tissue. So unlike augmentation, where we make a very small incision and sneak an implant in just to fill up and take up space, in this type of operation, we're removing a significant amount of the skin, but we want to put it back together so it looks pretty. So it's similar to making a dress, following a pattern and putting it together so it looks nice.
You know, we've gotten questions before of people asking, well, can they just use an implant for a breast lift?
Not really. If someone has pseudotosis, which is fake sagging, a breast implant will work, and that will just fill out the volume. Because if the breast is sagging because it's deflated and it's lost volume, the implant will replace that. But if the nipple is low, if the breast tissue is low, an implant can't really lift. It just sometimes compounds the problem by adding more volume.
Is that often the result of childbirth, breastfeeding?
Often, yeah. Childbirth, breastfeeding, or weight loss. But aging can do it too.
All right. Now we're looking at someone else here.
This is someone who's had augmentation, but she has capsular contracture on the right side, so the right breast appears smaller and higher than the left. And what I've done is gone in and opened up that capsule on both sides and replaced both the implants with a little bit larger implant.
And it's a little tough to see because we have to put, it's a family show, we have to put the black bar.
The bars are good though.
But yeah, so basically, what's the term again?
There's a lot more breast protruding underneath the bar on the left and on the right, and more above the bar on the right than on the left.
So do you often go in and you have to do corrective surgery on someone who's had?
Yes, I think overall, revision rates are close to 25% at 10 years. The most common reason we go back is to put bigger implants, but certainly capsular contracture, where the scar around the implant gets tight, is a common reason, and deflation would probably be up there in the top 3.
Is that a common problem that occurs with breast
capsular contracture? It is one of the more common problems, and I think part of the reason is it can happen at any time. Unlike surgical risks, things like infection, bleeding, if those don't happen around the time of surgery, they're not likely to ever happen. Capsular contracture tends to show up 3 months, at least 3 months out from surgery, but can happen 20 years later.
Is that something that's a problem with the surgeon, or is that just something that happens with the body in response to a foreign object?
I think certainly if I tried, I could make it happen more often. There are things that I can do to reduce the risk, but overall it's more just sort of a natural reaction, because we need scar around the implant. Without any scar, the implant would continue to drop and wouldn't be where we want it. So we need some scar there, but the problem is when the scar gets too tight or too thick, that it changes the position of the implant, and in those cases we're wanting to do something to fix it.
Okay, this leads me to the next question. Is it true that after, let's say, if you've had a breast implant and it's been there for 10 years, that you need to change it out, that there's a life expectancy for that implant?
Sure. Well, that's a great question. That's probably one of the other more common questions I get. And the rule of thumb is if everything looks fine and feels fine, even at 10 years, we can leave it alone. So there's no expiration date where we say, oh yeah, 10 years, we got to get in there and fix it. If they're fine, they're fine. But there are some other tests we can do. If someone has silicone implants, an MRI is a good test to look to see if the implant's intact and if there's any problems. Because sometimes it's very difficult to tell from the outside that there is a leak with a silicone implant.
I mean, are there some that just last a lifetime?
Sure. Sure. I mean, I can't say that breast implants are lifetime devices because some do fail. It's a man-made object. It can wear out. Sometimes they wear out because of trauma, sort of a car accident, or severe trauma, not usually, you know, pushing on it. But sometimes they'll wear out just because they fold and wrinkle and eventually crack.
Okay, we've got some phone calls coming in. We need to take a very quick break, but for more information about Dr. Mele, you can call him directly at 925-943-6353 or check him out on the web at drmele.com. He's also on sanfranciscobreast.com. And when we come back on Body Beautiful, we'll continue talking about breast lifts and reductions for women and men. Plus, we'll take your phone calls. Stay with us.